Welcome to Everyday Nursing Knowledge Lectures, and today we will learn different types of IV fluid. To know more about types of IV fluid and its effect on our body, we should be familiar about fluid distribution in our body and about osmosis. So around 50 to 60% or up to 60% of the body has water, and it is distributed as extracellular fluid and intracellular fluid. Extracellular fluid means fluid outside the cells, which is present as plasma inside the blood vessel, and there is space between the cells which is called interstitial space filled with fluid called interstitial fluid. So extracellular fluid has plasma and interstitial fluid, and there is fluid inside the cells which is called intracellular fluid. Now osmosis. Osmosis is the movement of solvent. Solvent means water. So water moves from a region of higher concentration to a lesser concentration. Or if you're describing as in terms of solute, so solvent is the water and solute is the particles. So if you're describing osmosis in terms of solvent, you can describe it as movement of water from a region of higher concentration solvent to a lesser concentration. But if we are describing osmosis in terms of solute, solute are the particles inside the water. Water moves from a less solute to more solute. Example, in this picture you can see two compartments. In first there is more water and less solute, whereas in second you can see less water and more solute. So you can see water moves from higher water area to a lower water area, or water moves from an area of less solute, that is osmosis. So less solute area to a more solute area. So osmosis you can describe in terms of solvent or solute. And this movement through a semi-permeable membrane is called osmosis. So in our body also, water within the blood vessels in the plasma moves out to the interstitial fluid and through a semi-permeable membrane inside the cells. And it occurs passively and through osmosis. Now let's see the types of IV fluids. IV fluids are generally classified into crystalloids and colloids. Crystalloids have small particles. As a result, water moves from within the blood vessels to the interstitial fluid and to inside the cells. And crystalloids are generally classified into three types, which is called isotonic, hypertonic, and hypertonic depending upon the tonicity. Tonicity means the concentration, the amount of the solute in it. Whereas colloid has larger particles, they are not able to pass through the membrane, and as a result it stays within the blood vessels. So it is also called plasma or volume expanders. Example, albumin, hespan, and dextran. Now let's see the difference between isotonic, hypotonic, and hypertonic. Isotonic means it has the same concentration of solutes as the blood plasma. Iso means same, tonic means tonicity or the same concentration as blood plasma. And few examples are 0.9% saline, LR, and 5% D5 water. So any dextrose containing solution may start as one category and ends as another. The reason is dextrose in our body get metabolized fast. So if you give D5 water, dextrose get metabolized fast. So it starts as isotonic, but as dextrose get metabolized, the remaining is just free water, which is less tonicity. As a result, it becomes hypotonic. Now let's see the effect or indications for using isotonic fluids. So since it has same concentration as blood plasma, there is no fluid shift between the extracellular and intracellular fluid. As a result, the cell size remains the same. So it is used to replace fluid volume due to blood loss, surgery, dehydration, etc. Next is hypotonic. Hypo means less, tonic means tonicity. So that there is less concentration of solutes than blood plasma. So few examples are 0.45% saline, that is half NS, 0.33% saline, that is 1/3 NS, and 0.225% saline, that is 1/4 NS. And if you look at the concentration is much lesser than 0.9. That includes the hypotonic fluids. Now what happens when you receive or when you give hypertonic fluid? So you are giving fluid with less solute. As a result, remember what happens in osmosis. Water moves from a lesser solute area to more solute area, and that is osmosis. So water moves from a less solute to more solute. So you are giving fluids with hypotonic or less solutes. As a result, water moves from the less tonicity area, that means inside the blood vessels, to interstitial fluid and to inside the cells. As a result, what happens? Cell swells or cell burst or lysis can happen. So this hypertonic fluids are used when the cells are dehydrated. You want the cells to get fluid. So this is indicated when the cells are dehydrated, and that is seen with DKA or hyperosmolar hyperglycemia. Now, what are the warning or the contraindication in giving hypertonic fluids? So when you give hypertonic fluids, what happens? Fluid from the extracellular moves to the intracellular. There will be depleting circulatory volume, or it can worsen hypovolemia. It is also contraindicated in increased intracranial pressure. The reason is hypotonic fluids can cause cell swelling. So you don't want the brain cells to swell more, which increases the intracranial pressure, because hypertonic fluid can cause fluid shift to the brain cells, which can worsen, increase, or which can cause increased intracranial pressure. So it is contraindicated in increased intracranial pressure. Also in burns and trauma, because this can cause or worsen hypovolemia. It can deplete the circulatory fluid volume. Next is hypertonic. Hyper means high and tonic is tonicity. So that means it has higher concentration of solutes than blood plasma. Example, 3% saline, 5% saline. If you look at the concentration is high. Now coming to dextrose containing solution, remember it starts as one category and ends as another. Example, D10 water. It has D10, the higher concentration, and water. It is hyper. It starts at hypertonic, but as dextrose get metabolized, it's just free water, which becomes hypo. So it becomes from hyper to hypo. Next is D5 half NS. Again, it is hyper, but once the D5 get metabolized, the remaining is just half NS, which is hypertonic fluid. So it becomes from hyper to hypo. Another example is D5NS. Again, starts as hyper, D5 get metabolized, the remaining is just NS, it becomes isotonic. So what happens when you receive or when you give hypertonic fluids? So it has more concentration of solute. The fluid moves from within the cells to the extracellular or to the blood volume. As a result, cells shrink, cells get smaller. So these fluids are used to treat cerebral edema. The key points you have to remember, they are vesicant, and it is usually administered through a central line, and usually these patients are in ICU for close monitoring. You have to monitor for side effects, example pulmonary edema and fluid overload, because more fluid gets pulled to the intravascular volume. So to remember the effects on the cell, you can remember iso means same, that means cell size remains the same. Hypo you can remember as hippo. What happens is cell gets swelling. Hyper means active. As a result, the cells shrink. So to summarize, remember hyper means active or hyper means active. As a result, the cells get smaller. Iso means same, so the cells remains the same. Hypertonic, hypo you can correlate or you can remember as hippo. As a result, the cell gets swollen. So today we saw different types of IV fluids, and thanks for watching my video.